Most people blame poor focus on willpower, or phones, or being busy, but there's a different possibility that gets missed. Sometimes, I can't concentrate, is your body waving a flag. Here's the tricky part. Medical red flags don't always look dramatic. They can look like you rereading the same paragraph 5 times, or forgetting why you walked into a room, or feeling mentally slow in a way that is new for you. So the goal here is simple. Separate everyday distraction from patterns that deserve a real medical check. Not to self-diagnose, just to notice when focus problems are paired with warning signs like sudden onset, neurological symptoms, major sleep changes, mood shifts, or medication side effects. And I want you to listen for one theme throughout. The why matters less than the pattern. New, fast changing, getting worse, or paired with other symptoms. If any of these sound familiar, the right move is often not another productivity hack. It's a conversation with a clinician, with specifics you can describe clearly. Moving to slide 2. Let's set a baseline. Normal focus problems are usually situational. You're under stress, you slept badly, you're juggling too many tasks, and when the stressor lifts, your attention mostly rebounds. Red flag focus problems behave differently. They're persistent, or they escalate. They show up across settings: work, home, conversations, reading. And they often come with a second change you can't explain, like headaches, dizziness, tremor, new anxiety, or unusual fatigue. A useful way to think about it is state versus trait. If you've always been a bit distractible, that's one category. If you were steady for years and then something shifted, that's another. Also, watch for effort mismatch. When you're trying hard, but your brain feels like it's slipping. Not boredom, not procrastination. More like mental traction is gone. This scene is not about labels. It's about noticing whether your focus problem is temporary and understandable, or whether it's a change that deserves a medical lens. Moving to slide 3. First major red flag: sudden onset. If your focus drops sharply over hours or days, treat that as a different category than a slow drift. A sudden change can happen with things like infections, metabolic problems, dehydration, medication reactions, or neurological events. And I'm not saying that's what it is. I'm saying sudden change is the reason to take it seriously. Here are the patterns that raise the temperature. You feel confused. You can't follow a conversation. You're disoriented about time. You're making unusual mistakes, or other people notice you seem off. If sudden poor focus is paired with severe headache, fainting, chest pain, shortness of breath, weakness on one side, trouble speaking, or new vision changes, that's urgent territory. And even without the dramatic symptoms, a rapid shift is still worth a prompt check, especially if it's out of character for you. When you talk to a clinician, specifics help. When did it start? What was normal last week? What else changed? Sleep, appetite, fluids, new meds, illness exposure. Moving to slide 4. Second red flag category: focus problems plus neurological symptoms. This is where you stop thinking productivity and start thinking body system. Neurological symptoms can be subtle: numbness or tingling that's new, weakness, new clumsiness, dropping objects, trouble finding words, slurred speech, new balance problems, a tremor that wasn't there, even a new change in handwriting. Vision also counts: double vision, a curtain-like loss of vision, new blind spots, or a big change in how your eyes track lines of text. Now, lots of these have benign explanations, but the combination matters. If focus problems show up alongside new neurological signs, that's a reason to seek medical evaluation quickly. A practical tip: don't describe it as "my brain feels weird." Translate it into observable facts. I'm mixing up words. I'm veering when I walk. My left hand is weaker. My vision doubled for 10 minutes. Clear details help clinicians triage what needs urgent attention and what can be worked up more slowly. Moving to slide 5. Third red flag: a major shift in sleep. Because sleep is not just rest, it's brain maintenance. If your focus is poor and you're also sleeping far less, waking up gasping, snoring loudly, or feeling unrefreshed despite enough hours, That's worth attention. Sleep apnea, for example, can fragment sleep and reduce oxygen levels.
People often notice it as brain fog, irritability, and memory slips before they ever think sleep disorder.
On the other side, sleeping way more than usual or being unable to stay awake during the day can also point to medical causes. So can a sudden flip in your schedule where you cannot fall asleep until very late, then can't function in the morning. Night sweats, restless leg sensations, or vivid dreams with physical movement can be relevant too. The red flag pattern is a clear change from your normal sleep combined with daytime cognitive impact. If you track anything, track this: bedtime, wake time, awakenings, naps, caffeine timing, and how alert you feel mid-morning. That data makes a clinical conversation much more concrete. Moving to slide 6. Fourth red flag category: mood and anxiety changes that come with cognitive changes. Because attention is not separate from emotion, they share the same brain resources. Depression can show up as slowed thinking, poor concentration, low motivation, and memory complaints. Anxiety can create a different pattern: racing thoughts, hypervigilance. You're scanning the problems, so you can't hold a single task in mind. But the red flag is not feeling stressed. It's a noticeable shift in mood, irritability, panic symptoms, or loss of interest that's new, persistent, and tied to impaired daily function. Also pay attention to extremes: periods of unusually high energy with little sleep, impulsive decisions, or feeling unusually driven can be clinically relevant, especially if it's not your baseline. And there's a physical overlap. Appetite changes, weight change, stomach issues, and headaches can travel with mood disorders. If you're trying to fix focus with stricter schedules and it keeps failing, ask a different question. Did my emotional baseline change first? Or did the concentration problem come first? That sequence can guide what kind of help you need. Moving to slide 7. Fifth category: medication and supplement effects. This one is common, and it's easy to miss because the timing can be sneaky. Some medications can cause sedation, slowed thinking, or memory issues. Others can cause jitteriness, insomnia, or a racing mind that makes focus impossible. And interactions matter. Two things that are fine alone can be messy together. This includes prescription meds, over-the-counter products, and supplements. Even natural products can have real neurological effects. And stopping something abruptly can cause symptoms too. Red flags here are a clear timeline. Focus got worse after a new medication, a dose change, or adding a supplement. Or focus improved when something was paused, then worsened again when it restarted. What helps is a clean list: names, doses, timing, and when you started each one. Also include caffeine intake and nicotine if relevant, because they can amplify side effects. One more detail people forget: decongestants, sleep aids, and some allergy medications can affect alertness and attention. If you suspect this category, the safe move is to bring the list to a clinician or pharmacist and ask for a review. Moving to slide 8. Sixth category: thyroid problems and other hormone shifts. Because hormones quietly set the speed of your whole system. An underactive thyroid can be associated with fatigue, slowed thinking, low mood, feeling cold, dry skin, constipation, and weight gain. An overactive thyroid can look like anxiety, restlessness, insomnia, heat intolerance, palpitations, and difficulty focusing because your body feels revved up. Hormones also include cortisol patterns, perimenopause and menopause changes, and other endocrine conditions that can affect sleep and cognition. The red flag pattern is focus problems, plus a cluster of body changes that don't fit your usual, especially if multiple systems shift at once: energy, temperature tolerance, hair or skin changes, heart rate, bowel habits. This is where basic lab work can be useful, guided by a clinician. Not because labs solve everything, but because they can rule in or rule out common medical contributors. If you're trying to brute force your way through brain fog with more effort, and your body is also sending physical signals, it's reasonable to ask for a medical check rather than just another planner. Moving to slide 9. Seventh category: blood sugar swings and metabolic issues. Your brain runs on glucose, but it needs it in a stable way. If you notice poor focus along with shakiness, sweating, sudden irritability, headaches, or feeling faint, especially when meals are delayed, that can be a clue. Some people describe it as their brain powering down. Others feel suddenly impatient or panicky. High blood sugar can also be associated with fatigue, blurry vision, increased thirst, and frequent urination. Again, not a diagnosis, just patterns that should prompt a check. The red flag is recurrent episodes that follow a predictable trigger, like long gaps between meals, intense exercise without enough fuel, or certain high-sugar meals followed by a crash. A simple thing you can do is log timing, when symptoms hit, what you ate, how long since your last meal, and whether symptoms resolve after eating. If you have risk factors like family history, significant weight change, or you're waking at night to urinate, it's even more reasonable to ask a clinician about screening. Moving to slide 10. 8th category: nutrient deficiencies and anemia. This is one of those unglamorous medical causes that can feel like pure mental weakness. Low iron, for example, can be associated with fatigue, shortness of breath on exertion, paleness, headaches, restless legs, and trouble concentrating. Vitamin B12 deficiency can affect energy and sometimes cause tingling or numbness. Folate issues can overlap. Vitamin D deficiency is common and may correlate with fatigue and low mood in some people. The focus point is this: if your concentration problems come with physical fatigue that doesn't match your activity level, it's reasonable to ask about basic blood work. Red flags include heavy menstrual bleeding, restrictive diets, gastrointestinal issues, recent surgery that affects absorption, or chronic inflammation. And one more: if you're craving ice, that can be associated with iron deficiency in some cases. Again, don't guess and start random high-dose supplements. The better move is testing guided by a clinician, because too much of certain nutrients can also cause problems. Moving to slide 11. 9th category: headaches and migraines. Because for many people, migraine is not just head pain, it can be a brain-wide event. Some migraine patterns include brain fog, trouble finding words, light sensitivity, nausea, and sound sensitivity. And sometimes the cognitive symptoms come before the headache, or even without much pain at all. Red flags are different: a sudden severe headache that peaks fast, a new type of headache after age 50, headache with fever, stiff neck, fainting, seizure, weakness, confusion, or vision loss, headaches that wake you from sleep, or a headache that is steadily worsening over time. Also, pay attention to headaches after a head injury, even a seemingly mild one. Concussion symptoms can include concentration problems, irritability, sleep disruption, and sensitivity to light or noise. If headaches and focus problems travel together, track triggers and timing. Sleep changes, dehydration, certain foods, stress spikes. That log can help a clinician distinguish migraine patterns from other causes. And if any red flag headache features show up, that's a reason to seek urgent care. Moving to slide 12. 10th category: infections and inflammatory states. When your immune system is active, cognition often drops. People call it sickness brain. With common viral illnesses, it can be normal to feel foggy for a short period. The red flag is when cognitive symptoms are severe, prolonged, or paired with concerning signs like high fever, stiff neck, severe headache, shortness of breath, chest pain, or significant dehydration. Also consider hidden infections. Urinary tract infections in older adults can sometimes present with confusion more than pain. Dental infections can contribute to fatigue and brain fog. Chronic sinus issues can disrupt sleep and attention. Inflammation from autoimmune conditions can also be associated with fatigue, pain, and cognitive complaints. Not everyone gets the same pattern, which is why clusters matter. If your focus problem started after an illness and never really resolved, that's worth documenting. When it began, what symptoms you had, how long the fever lasted, and whether you returned to baseline. A clinician can decide whether this is a normal recovery curve or something that needs evaluation. Moving to slide 13. 11th category: substance effects, including withdrawal. This is sensitive, but it's a real medical factor. Cannabis, stimulants, sedatives, and certain recreational drugs can affect attention, memory,
sleep architecture, and motivation. And withdrawal can do it too. People often describe a period of fog, irritability, poor sleep, and difficulty concentrating when they stop or reduce a substance. Even caffeine can be part of the picture. Too much can cause anxiety and fragmented focus. Too little, if you're used to it, can cause headaches and sluggishness. The red flag is when focus problems track tightly with use patterns. Weekends versus weekdays, nights versus mornings, or a clear change after stopping. If you're talking to a clinician, it helps to be factual. What, how often, how much, and what changed. And if you're worried about dependence or withdrawal, that's not a moral issue. It's a health issue. Getting support through a clinician can make the process safer and more structured. Moving to slide 14. Now let's make this practical. If you're going to get help, you want to show up with a clean story. Clinicians are pattern detectives, but they only see what you can describe. Here's a simple framework. First, onset. When did you last feel normal? Second, course. Is it stable, improving, or worsening? Third, context. Is it across settings or only in one environment? Fourth, associated symptoms. Sleep changes, headaches, mood shifts, dizziness, palpitations, appetite changes, pain, numbness, vision changes. Then list exposures. New medications or supplements, illness, head injury, major stress, substance changes, travel, diet changes. And quantify impact. Are you missing deadlines, making financial mistakes, getting lost while driving familiar routes, forgetting appointments, needing to reread everything? This matters because I can't focus is vague. But my focus dropped 3 weeks ago. I'm sleeping 9 hours and still exhausted, and I'm getting new headaches is actionable. If you want one takeaway, it's this. The more specific you are, the faster the right next step becomes clear. Moving to slide 15. Let's close by tying the red flags together. Poor focus becomes medically concerning when it is new, fast-changing, worsening, or paired with other symptoms. Especially neurological signs, severe headaches, major sleep disruption, or confusion that other people notice. If any of those show up, the goal is not to panic. It's to escalate appropriately. Urgent symptoms deserve urgent care. Slower patterns deserve a scheduled evaluation with a clear log. And if your focus problems are real but don't match red flag patterns, that still matters. It may point to sleep quality, stress load, mood, or environment. But you don't have to guess alone. One practical action. Write a 1-page summary. When it started, what changed, your top 3 symptoms, your medications and supplements, your sleep pattern. Bring it to an appointment. If you want more content like this, subscribe. And for a quick check-in, comment A or B. A means your focus issue was gradual. B means it felt sudden. This information is not a substitute for medical advice. Resilience is the foundation of longevity.